Across Nigeria, primary health care centers are meant to be the first line of care where life begins and health is protected. But for years, many PHCs have faced deep challenges, underfunded, under-equipped, and are unable to meet the needs of the communities they serve. Yet today, a transformation is underway. The National Primary Healthcare Development Agency, in partnership with state and local governments, the private sector, and everyday citizens, is breathing new life into PHCs across the country through the PHC Revitalization Initiative.
It is a collaborative intervention between the government of Nigeria, the World Bank, and then the state governors. The objectives of the project basically is to reduce under 5 mortality by 15% within 5 years, and then by 40% within 10 years.
Amma yanzu alhamdulillah da zuwan in fact abubuwa ya zo ya canju. Abubuwa da dama da idan an zo lokacin mai aihuwa sai a ce ba mutane ba ma'aikata ko maybe saboda rashin gurin kwana da sauransu.
Before the revitalization, we don't have staff quarters in the clinic. Our staff used to come from town, from their houses or where they rented house in the town. When we have labor or deliveries in the night, we have to send an Okada to call the female staff to come and attend to the labor.
Dan muka zo komin dare muka buga ma mutum kofa zai bude kuma gaskiya zai zo ya lura da wanda aka kawo shi.
This is not just a project, it's a promise to restore dignity, rebuild trust, and ensure every Nigerian, no matter where they live, has access to quality healthcare. In Nasarawa, Bauchi, the FCT, Oyo, Osun, Enugu, and more, we visited communities where hope is being restored. We saw change. We listened to pregnant women, nursing mothers, health workers, and local leaders speak from the heart. Their stories are real, their needs are urgent, but so is their belief that better days are coming.
Where we usually conduct the ANC was damaged by flood 3 years ago. Now, after the ANC shed was revitalized, renovated, equipped with chairs, you can see them today.
So our family yìí wọ́n ti fún wa ní láti iwájú ilé títí dé ẹ̀yìn lọ́hùn yẹn òun ni wọ́n fún wa. Ẹ̀yìn yẹn wá jẹ́ ilé àtijọ́ tó jẹ́ pé a sì nídìí àtúnṣe oríṣiríṣi kí wọ́n bá wa ṣe síbẹ̀.
Health center ọdụ hovu mma na mbụ ndị mmadụ anaghị alike ibi ebe a because of ka otu o si dịrị ha enweghị good environment and enweghịkwa equipment ha ji arụ ọrụ. Kịta n'ihe niile environment dị very neat, even tiles, amacha tiles everywhere now. Mana before, environment dị so tattered.
Ndị ohere a wee na-ekene gọọmenti na-asịkwa ka ha gbatara anyị ọsọ enyemaka.
Wuce kamar watanni 4 da suka tun daga wata 8 da suka wuce baya inda muke dinnan baya zauno don ruwa ya bata iska ya bare zin din ya tafi da shi sai ya zama duk wasu ayyukan da zamu yi nan ba zai yiwu ba amma yanzu duk an samu wannan sai ya zama yanzu bamu da wani matsala da yake shafi inda infrastructure ne a wannan wurin a yanzu halin da ake ciki. Kamar as at last year January client dina ba su wuce guda 100 da wani abu ba. Of which a January a wannan shekarar na da kusan 200 da wani abu.
Sannan kuma akwai ruwa isasshen ruwa 24 hours muna da ruwa. An zo an sa mana solar kowane ɗaki yanzu aka shiga za a samu ruwa.
The challenge during contact with this facility was lack of staff.
We have 6 trained staff and we have 6 non-trained staff. We have a space that can give us the staff quarters, but there are no staff quarters. So it's making my staff finding it difficult in terms of coming to work.
And the facility must have a staff quarters, because what we realized was that most of our staff, because there is no accommodation in the facility, so they will come and then they will work, but when it is night, you will discover that nobody is there.
Before this facility, we used to see patients only just 20, 15, but now over 100. Even they forget going to the general hospital. They prefer to come here. Even the local government committed themselves because of this renovation. They added this block to the facility.
Before, over the month, we are just taking 5 deliveries, but now we are taking more than 30. In the aspect of equipment, we have it enough.
Muna murna da wannan abubuwa da suka faru, yanzu muna jin daɗi sosai ba kamar shekarun baya da suka wuce ba.
Pé téèyàn bá ń lo nǹkan, ó máa ń kò sí pé yóò máa tuntun sí. So téèyàn bá dẹ̀ lo nǹkan tó bá di pé ó ń fade, ó ń worn out, ó nídìí kí èèyàn ṣe àtúnṣe náà ni.
Ìgbà tán ṣe innovation yẹn, a ní láti kó àwọn olóyún wa, a kó wọn round káàkiri inú wọ́ọ̀dù wa pé kán wà. Gbogbo wọn sọ pé àwa ò, inú wọn dùn pé in fact èmi gan fẹ́, ẹni tí ò ní lọ́kàn pé òun fẹ́ bímọ sí hospital tẹ́lẹ̀ gan, in fact màá bímọ sí ibi, èmi máa kọ́kọ́, in fact wọ́n fẹ́ lè sọ pé ká máa yọ ọmọ ní ìdí àwọn lẹ́sẹ̀kẹsẹ̀ nígbà yẹn. Èmi mo kọ́kọ́ fẹ́ sùn sí bíbá yìí o, èmi náà fẹ́ sùn sí bíbá yìí o, ṣe mọ̀, tó mú yàtọ̀ bá.
Ilé alágbo ni mo máa ń bí wọn sí tẹ́lẹ̀. Bọ̀ ibi ilé alágbo tí à ń lò yẹn, ìgbà tó ti kúrò ńbẹ̀, èmi ò fi lọ síbi ibẹ̀ mọ́, èmi fi wá sí hospital. Ó kójú òṣùwọ̀n dáadáa. Tó bá jẹ́ tẹ́rìn tó yàyà àwọn ìlera mọ́ wa wọn. Kódà bọ́n ṣe máa ń ṣe sí wa gan, àwa gan máa ń rò pé àṣọ hospital wọn wà pẹ̀lú bọ́n ṣe máa bá wa ṣọ́yà àwọn ìbínú sí wa. Kan tá a bá ṣe tó bá yẹ kán bínú gan, wọ́n á tún correct wa pé báyìí ni ká ṣe, báyìí ni ká ṣe, àdèmàgò correction.
Mbido nwa obi anwụrụ ma arụbeghị arụ. So ru 3rd November. Ifu na ọrụ ebido eziokwu ka bido kpefuwe pan, kpefuwe zinc. So I made some roof zinc last year.
Mgbe renovation mecha abịa dozie ebe a ma tiles. Patient na-abịa ebe little by little. At least now ndị mụrụ nwa batakwa ebe ha ga-amụ nwa. Ebe a dịlụ neat. Ọ dịlụ ka hospital.
The primary care facilities require a lot. They require basic equipment to operate. They require light. They require water, and they require some furniture.
As a maternity in charge, gaskiya na fi kowa murna domin ruwan nan kawai ma ya bani farin ciki.
Our PHC, as far as we are concerned, there are much improvement more than before. The people face difficulty in accessing healthcare services, but we thank God with the PHCs, people tend to have the first aid treatment at the PHC before coming down to general hospitals.
With 901 PHCs already revitalized as of April 2025 and over 2,700 more undergoing transformation in 2025, this documentary captures a national movement in motion, a journey of turning despair into healing.
To amma a yanzu mun sami saukin sa wanda ma ba sai an ji tuka ba. Now we have lights 24 hours.
I want to use this golden opportunity to thank the federal government who remember Ogogo Health Center.
Ba abin da har ban san ma me zan fada ba, na gode kawai. Gaskiya.
This is the story of Nigeria's PHC revitalization, and it's only just begun.